So today we have Dr. Sudha, very experienced endocrinologist with us. So I've known Dr. Sudha for a very longest time. She has done internal medicine before endocrinology, and she treats all kinds of endocrine disorders. So our members and other like family and friends, they've had a lot of questions and concerns about fitness and endocrine disorders in general. So Sudha has graciously accepted our invitation to come on our show. Welcome, Dr. Sudha.
Hi, Sarita. I'm happy to be here.
Yeah. So, Dr. Sudha, so basically, you have been practicing endocrinology for a long time. So, I am sure you also have family members asking questions about different kind of, we all have family, and then once they find out like we are doctors, like we get a lot of questions. So, these are like general questions we get from our family members and also S2 members. So the main idea of S2, you have known me, and then we wanted to bring the truth forward and break all the myths so that our patients can take right decisions about their health and fitness. So we can, kind of start with, in general, we want to know how do hormones impact metabolism and weight. Can you talk something about that?
Um, to say the least, I mean, your hormones do affect from the time you are born. So, how you grow, how you have puberty, either male or female, um, how you get through a reproductive life, and how you go through, menopause or bone problems. So, we treat a, array of metabolism problems throughout. So, to say the least, hormones are always there. So,
Yeah.
in regards to health and wellness, I would say among all the other hormones, a few that we hear a lot are insulin, cortisol, thyroid, estrogen, progesterone in females, and testosterone in males. So,
Right.
um, overall, I would say that each hormone does have function for metabolism, and it does affect crucial parts of how you're losing weight, gaining weight, what your basal metabolism rate is, how your cycle changes, things about your wellness, or the weight gain, weight loss. So when we go to specific questions, I'd be able to explain more, but overall,
Got it.
they
Got it. Yeah.
100% play a role in um, how you achieve your fitness goals, for sure.
Got it. Got it. So, we can break it down to simplify, to the listeners. So, the first question I know I wanted to ask is, can you explain more about, insulin resistance?
um, it's a broad topic, but let me break down to like 2 or 3 points.
Yes.
This is the most common reason why you would have pre-diabetes or diabetes or PCOS. um, the jargon that's used around a lot. The basic thing that's going on is insulin resistance. So your body, whatever you eat, uh, breaks it down to glucose, and sugar is not good for your organs. They make it, the sugar makes your organs age faster. So there's always protective mechanisms in your body to take care of that. So insulin is one of that. So there's always insulin coming in to decrease your blood sugar levels. And with all the lifestyle changes that we have, or dietary changes, there's sugar all around with our foods. So that hypoglycemia makes sure that your body is always having insulin levels which are high, and then it gets resistant. It doesn't work anymore as it should. So that's what we call as insulin resistance. What makes you sensitive is exercise, eating less foods which are sugary, or cause that need for insulin to be there.
Okay, okay. So the common problem we see is, especially like now among, even the teenage young females like these days, and even in the women like 30s and 40s, also the PCOS. In previous days it used to be like just regular polycystic ovarian disease. Now it's mostly, I think, acquired because of the dietary habits. Can you speak something about that?
Yeah, I see a lot of young female patients with PCOS. It's a clinical diagnosis, um, but the basis of PCOS is metabolic syndrome or insulin resistance. If you get to the bottom of it, that again comes up to weight gain or imbalance in your hormones, how your ovaries look on ultrasound, or um, the first thing that we recommend for this is health lifestyle changes. Again, the ways to increase your sensitivity, your by making lifestyle changes. Again, there are medications for it, which are more like hand holding, you know, hand holding to say the least,
Mm-hmm.
that they help you for a little bit, but um, the basis of you want to change PCOS or would be lifestyle management for 6 months at least. And
Right.
there are other medications, which again, if you're not able to do it with just lifestyle, then for a short period of time, we help you with medications.
Right,
Uh,
right. Yeah. And the same with the like, kind of pre-diabetes or like, diabetes also, like, kind of in the beginning stages. For all these, we suggest like a small dose of metformin. And,
mhm.
we know from actually like talking to our close friends and family members how reluctant they are to start on a low dose metformin. Can you speak something about like, metformin?
Yeah, for some reason, maybe there's articles or your patients are receiving some, you know, you know how the information spreads now. The false information spreads faster.
Yeah.
In this world of all the, insurance problems that we have for coverage of drugs, everything, I always tell my patients metformin is the cheapest and the best medicine, because it helps you increase that insulin sensitivity, which is the basis for
Mm-hmm.
probably all the problems,
Yes.
even if they are insulin dependent or if they are on other medications. We always want metformin in the background to make the most of what they're already taking to make it effective. um,
Yes.
I mean, for me, I always say metformin is a hero. It's cheap, it works.
It works. That is so true. And as a I mean, I'm sure as an endocrinologist, like you see a lot of patients worrying about, kidney damage. And I'm here as a kidney doctor, and I'm here to tell that, metformin does not cause any direct kidney damage at all. Like, I
Yeah, exactly.
recommend
Other way
metformin.
around, that you're seeing me every few months to make sure that you're on the right dose, and I'm adjusting it to what your kidney function is. Because
Yes.
so it's rather the other way around, that it's protecting you from, if
Right.
your diabetes is better, you're insulin sensitive, then
Exactly.
your
Yeah.
kidney is better. So
Yeah.
yeah, it
Yeah.
does need some convincing for sure.
So, in this matter, I think like a lot of people need this kind of exact education. We all need to educate everyone that the disease affects the kidneys or the heart much, much more. The
Yeah,
medication is it's good because it
it's
protects your
always,
organs.
again, anything in life is benefit versus risk, right? So when the benefits outweigh it, that's when it's prescribed or it's indicated
Yes,
for any reason. Again,
exactly.
nothing in nature is free. Even if you eat the healthiest food for 10 days in a row, you'll have side effects from it. So
Right, right. Yeah, yeah, yeah. And that's a topic for one more, like, one more podcast, like,
yeah,
how people overuse some things. But that's a good point. You need to protect your organs because diabetes damages every single organ in the body, starting from your eyes to your nerves in the legs. It causes every single organ damage. So it's better to kind of exercise, eat right, and if you have to take medications, the medications are like
Yeah, I
much
want to
more
add
safer
one more
now.
thing about metformin these days is that it does have some anti-aging properties.
Okay,
Even the the longevity medicine recommends metformin at a low dose.
it's good.
So
Yeah,
something lucrative for
yeah.
people who are
Oh,
only looking for that benefit.
that's good. I didn't know about it. That's like
Yeah.
it's good to know. That's good. Yeah. Yep. And then, after that, one other thing, one other hormone which really influences weight is a thyroid hormone. And I see a lot of patients who don't want to take thyroid medicine. They want to depend on food changes, natural remedies. Could you talk about that?
Again, thyroid hormone is very, very, very important to sustain your life. I have had patients who have like abnormalities in thyroid, like really to the point where they could be in the hospital or ICU, but they don't want to take the medicine. So I think this fear stems from not knowing what it does.
Yeah.
So when you sit them down and say this is where you have thyroid receptors all over your body, like every organ has it. So when you don't give your body the thyroid medicine it needs, then the basic metabolism rate falls down, or it's like a slow machine. You become really slow, and
Yeah.
that does take a toll on your heart or muscles, or
Yes.
overall how you feel with your energy levels. So again, it's the opposite when you're hyperthyroid. So as it is part of your annual checkup for a reason.
Yeah, yeah, that's a good point, and then a lot of people don't even go for annual checkups. That's another point I want to make. There's a reason why, the doctors want to see patients annually because we care for the patients and then we want to check everything like, annually just to make sure everything is functioning fine because in this day and age where we are eating so much processed food, it's very
Yeah.
important.
Another point is, by the time you see the effects, the disease is already progressed. So if you want to do
Yes.
something before you go there, prevention aspect is more important,
Important.
that you're checking on your routine labs, or just listening to your body. If you're feeling tired, you want to go have some tests, not
Right.
assume that you ate something or this is your feeling or something like that. So listening to your
Yes.
body.
Yeah. And, the thyroid not only affects your weight, also it affects your mood,
Right.
your intestine motility, everything it slows down. And it's totally treatable,
Yeah,
actually.
and my patients, when they come and say, "Oh, I thought this was certain symptoms," they assume with it's hypothyroidism, and certain symptoms they say hyperthyroidism, and
Yeah.
they're just assuming that, oh, my thyroid's probably functioning more because I have diarrhea or something like that. So I say, I can explain any symptom with your labs, because that's more objective evidence. So
Yeah.
don't just go by what the internet or the Google tells you. Again,
Yeah.
we train for a reason, that you're looking for intricacies in what could go wrong. So
Yeah, yeah, that is so true. We went through like 4.5 to 5 years of rigorous training and internship and then specializations. We read through so many books for a reason. So don't go by Google, false information. We are here to give you right information. And yeah, okay. And the after thyroid, we wanted to touch a little bit on cortisol, the stress hormone, because we see a lot of people under a lot of stress, work related, family, kids, or any stress. So, can you talk about that?
um, cortisol's like a hot topic now.
Yeah.
Everybody is checking cortisol because there's more awareness to cortisol now. Um, as in it Basically the function of cortisol is to maintain your circadian rhythm. Your immunity depends on it, how your natural disease fighting properties, how you heal. There's a lot of effects from cortisol. When it's imbalanced or you're always it's a fight or flight hormone. So when you're always in a stage of stress, then it's very elevated, then your body's in a where you say fight or flight response. When you're in such mode, then you're gaining weight because the body thinks so that you need more sugar. Your blood glucose levels are high. Your body's preparing to fight something from the outside. That's supposed to be just for a little bit in your body, not all the time. So, I mean, there are physiological reasons why you would have high cortisol, and there's pathological reasons. When you see endocrinologists, we are ruling out pathological reasons. And when we rule out big bad things first, we determine that this is stress, then we talk about how would you like eliminate stress from your life. I mean, it's not completely eliminatable, but maybe little things that you include in your life where you want to calm down and not be on fight or flight mode all the time.
Yeah, yeah. And that's really important. And could you talk about how exercise can help in the stress like relief process?
Just basically for someone who's done like 40 minutes of exercise, I can say that I'm more concentrating on, although how tough your life may be, that 40 minutes you're only focusing on how bad it hurts or how much you're sweating or you have to finish these reps or so. That kind of clears your brain of the stress that you have. And you might have known already that exercise does release endorphins,
Yes.
happy hormones. So that's almost like fighting your cortisol off.
Yeah, yeah. And that's a very good point, because I see a lot of, people saying that we are so busy, we have so much work stress, kids, activities, we don't have time for workout. And they go into this stress mode, and the weight gaining mode. This is one of the reasons why it's important to take that 30 to 40 minutes out of your life. Even 3 days a week is fine, because you have to fight that stress away.
Yeah.
They think that they are adding this extra burden of workout, but then this is not a burden. This is a stress reliever.
I mean,
It's
if you
very
really sit
important.
down and talk to yourself, I think everybody can say that these are excuses that you're telling yourself.
Yes,
So,
yes. Yeah, because day in and day out, I mean, I keep telling that as physicians, if we are able to take 40 minutes out of our life every single day to take care of ourselves, I think,
you have to prioritize yourself. Okay.
yes, we just have to be.
If you're not
Correct.
feeling well, you're not able to be your best. So what can you change? If
Yeah.
taking 15 minutes out of your day will make you a better partner, mom, I think
Yes,
it's worth it.
it is totally worth it, of course. Yep. And then the next, thank you for watching. Stay tuned for part 2.